Look at this toenail. What do you think it is?
I'm pretty sure that you answered fungus, but surprise, it's not fungus. And look at these toenails. None of them are fungus.
None of them. Today we're breaking down the most common toenail conditions that look like fungus, but they're not.
Hi, I'm Dr. Blanchett.
And I'm Dr. Richard. We're board certified podiatrists and also foot and ankle surgeons.
Today we're gonna go over 4 conditions when the toenail looks very weird, but it's actually not fungus.
I think it's really important that we go over this because I see patients trying antifungal treatment for months, even years, but they never had the proper diagnosis in the first place. So they were just treating the wrong thing.
The only thing that the general population knows about nails is fungus. There's huge books that are written about nail pathology, and fungus is only like one chapter of all of those. There's so many things that can happen to the nails, and we see this in the office all the time.
Psoriatic nails.
This one is really close to my heart because my dad has psoriasis and also has psoriatic nails. For the longest time, before I was in podiatry, we all thought it was fungus. But the more I learned, and then I was looking at his nails, and I'm like, no, this is actually psoriatic nail. This is not fungus. He's had psoriasis for a long time. He has the classic plaques. He has some in his scalp. He has some on his elbows. And now on the nails too. There's also a very strong association with nail psoriatic and psoriatic arthritis. There's specific signs that we can look for that are gonna give us clues that this is actually psoriasis.
The most common one is nail pitting. This is what it looks like. It looks like a needle pierced the nail in multiple areas. Then you can have leukonychia, that's basically white discoloration of the nail plate. Also, nail crumbling. The nail becomes really brittle and can crumble.
Other signs are also subungual hyperkeratosis. So basically it's just a lot of debris, a lot of thickened skin underneath the nail. Next is oil drop discoloration. So it's gonna literally look like there's a little oil drop that fell on the toenail, and it's gonna cause an orangey, even like salmon discoloration of the toenail. Lastly, we have splinter hemorrhage. This is when the small little vessels underneath the nail plate get damaged, and it's gonna cause a little bleeding underneath the nail.
When those capillary breaks, it creates a little brown, reddish discoloration, but as the nail plate grow out, it creates a streak.
Splinter hemorrhage can be associated with psoriasis, but also with infective endocarditis, which is when there's an infection in the valves of the heart, and it's causing tiny little blood clots to go over the whole body. And you see them on the nails. So if you do have splinter hemorrhage, don't just assume it's psoriasis, maybe go see your doctor just to make sure.
To diagnose psoriatic nails, it's basically based on the clinical sign, what we see, but also the patient history. They will likely have psoriatic plaques somewhere else on their body.
Sometimes they actually don't even know that. They just think it's dry skin. I'm gonna tell them, can you show me? Show me your elbows, show me your knees, because psoriasis is often gonna have the silvery plaque with like a red base on the extensor surfaces, meaning the elbows, the knees, also on the big toes too.
Also, psoriasis can be on the sole of your feet, but it would look really different. You're gonna see more cracks, or sometimes even there's little pustule.
Like pimples.
And I had a patient that had the classic sign of psoriatic nails. And he was in denial. He was like, I don't have this condition. But then I pushed, and he decided to see his dermatologist, and he was diagnosed with psoriasis. And it's a blessing in disguise because now he does know that he has this condition, and now he can treat it properly.
And then not waste money and time on antifungal that are clearly not gonna work.
Talking about that, you can have a superimposed infection, fungal infection on top of psoriasis. So it's always good to do a nail biopsy to see if you do have fungus as well.
The nail's already diseased, so it's easier for the fungus to come in and attach and start infecting the nail. Onychomadesis.
This condition is when the nail lifts up, but from the base. It looks like this. Usually it comes after a systemic illness. Let's say if you had like hand, foot, and mouth disease, 4 to 8 weeks after having that illness, the nail will lift up. And it's because it was such a shock to your body. The matrix, the cells that produce the nail plates are like, let's stop producing a nail. And that's why you see the nail separation.
I actually had hand, foot, mouth disease, me and my daughter. This is not fun at all. And then I had onychomadesis. My daughter also on her thumbnail, like piece of it came off.
Yeah, that's a good point to mention. So the nail will list, but as it's growing out, it can fall off.
And it can be freaky.
Yes.
My nails fell.
Yeah, but usually it's not painful though. Unless you cut that part on something and then it rips off the nail that is attached, that one can be painful and bloody.
Yes. In podiatry, we actually see onychomadesis very commonly. And this is usually caused by micro-repetitive trauma. And oftentimes it's gonna be at the big toenail. Patients are gonna come in and they're gonna say that their nails are not growing or they're just getting thicker and thicker and thicker. And I look at the nail and there's layers of nails. The nail grows and stops, grows and stops, grows and stops. So every time there's a rest in the growth, there's gonna be a separation of the nail and a new one's gonna grow. And it's gonna start to get thicker and thicker.
We see that repetitive trauma at the tip of the toe, often with a specific foot type. So if you have a lazy first metatarsal, it's also called first metatarsal hypermobility. What happens is you're gonna get a functional hallux limitus. So basically when you try to propulse, the big toe joint won't be able to do that motion because the first metatarsal is lifted up. So this one is gonna block and then the motion is gonna go to this joint right here, the IP joint of the hallux. The distal phalanx is hyperextended like that. So it's gonna hit the shoe every single time you walk.
And this is exactly what happened to this patient over here. And what we did, we made orthotics and also we told her to wear bigger shoes because as you could tell, it was happening also in the lesser toes and the smaller toes. We also took nail biopsy to make sure it wasn't fungus and it was not fungus. We also checked her vitamins and blood work just to make sure that everything was fine systemically, which everything was. So she got bigger shoes, she got orthotics, and this is what she looked a few months later.
Amazing.
I know. Crazy.
Subungual Hematoma.
This is another one that can come also from trauma. It can be both from a big trauma, like you drop something on your toe, or it can also come from micro-repetitive trauma, similar to what we just talked about with the onychomadesis.
So a subungual hematoma is blood underneath the nail plate. So it's your nail bed that has been bleeding. Usually that one can also be painful and it will look completely different than the onychomadesis. It's gonna be more blue, brown, or red underneath your nail plate.
And it can affect the whole nail or just a portion of the toenail.
With this condition, obviously, if it was a big trauma, we're gonna take an x-ray just to make sure that the phalanx, the bone right underneath your nail plate, is not fractured.
If the nail involvement is more than 25%, usually we're gonna recommend to do a nail avulsion, so to remove the toenail to examine the nail bed. If there is a laceration, this is then considered an open fracture. It's gonna need to be cleaned out. The laceration will need to be sutured. We're gonna need antibiotics and then also an update on the tetanus.
If you're interested to see what we're talking about, we made a video on total nail avulsion and all the nail procedures, so go check it out.
Stop over there.
Microtrauma is often seen also with our runners because they're running, always hitting the end of their shoes, and because the blood separates the nail plate from the nail bed, often the nail can also fall off down the line.
Onychodystrophy.
You're not gonna believe us, but this one can also be caused by trauma.
There's a lot of trauma in the foot. Think about it. You know, you're walking on it all day, like thousands of steps, and then you're like in the shoes, and then you can hit on the shoes, and then as we just learned earlier, the bone actually on the bottom can hit the toenail. So there's just so many different ways to create trauma onto the nail. And then what I explained to my patient for onychodystrophy is similar to callus. So, you know, a callus is there because there's a point of pressure. Onychodystrophy, it's very similar because there's a pressure point and the nail is gonna get thicker. We see this very often in people with hammer toes because their toes are just kind of like gripping the ground as every time they're walking, and then the nail defends itself and becomes thicker, basically.
The clinical signs for onychodystrophy is gonna be thickened toenail, misshapen nail, discoloration, so it really looks like fungus.
The discoloration is there because the nail is thick. So now there's more keratin layer. Instead of being nice and clear and transparent, then you're gonna start seeing yellow discoloration just because of the thickness of the keratin layer.
Are you able to tell which one is fungus, which one is onychodystrophy?
Comment down below which one you think is fungus, A or B.
If you wanna know the answer, follow us on our short channel. We're gonna reveal the answer. Some ways to differentiate the two is with fungus, you can get a little bit more onycholysis, so it's lifting of the nail plate and the fungus will hide underneath. And when you cut your toenail, you can also have some malodor. We're giving you little cues so you can know which one is which. Okay, that's a wrap for today.
And remember what we discussed about today. Even if your toenail looks funky, please don't assume it's fungus because it can be multiple different things. Today we learned about
psoriatic nails, Onychomadesis, Subungual Hematoma, and Onychodystrophy.
So please don't run to the pharmacy to try to get topical antifungal medication.
That's gonna waste your time and money.
Instead, go to your podiatrist to get the proper evaluation and a treatment plan for your toenails.
Oh, there's so many other conditions that can look like fungus. We're gonna do a part 2 of this.
Yes. If you like this video, make sure you subscribe to the channel and hit the notification bell so you're gonna be notified when part 2 is released.
When you have abnormality of your toenails, it can often also cause ingrown toenails. When the nail is thickened, it's gonna dig more inside the skin. So watch this playlist next to know more about ingrown toenail.
And we'll see you next time.
Bye.